What's up, Wolfpack? I'm Matthew Lee, here to discuss the ethnic implications of the COVID-19 pandemic. The Centers for Disease Control and Prevention reported that COVID-19 has had a disproportionate effect on the African American and Hispanic Latino communities. From a study of 580 hospitalized patients, the CDC states that 33% of hospitalized patients were Black compared to 18% in the community, and 8% were Hispanic compared to 14% in the community, suggesting an overrepresentation of African Americans in the number of hospitalized patients. In Chicago, African Americans make up 30% of the population, but 46% of the city's positive cases and 60% of total deaths. Chicago Mayor Lori Lightfoot recently spoke with MSNBC about the city's response to these disparities.
We started educating people through a racial equity rapid response team to talk to them about the virus, disabuse folks of the notion that Black people can't get the virus, and really to connect people up with services, and made sure that we have a feedback loop continuously going between the neighborhoods and our emergency operation response.
So what accounts for this highly disproportionate effect on these specific communities? The CDC suggests the fact that ethnic minorities are more likely to reside in more densely populated regions due to racism and segregation, which can lead to more adverse health outcomes, underlying health conditions, and lower access to healthcare. In addition, many of the people in these communities have also continued working out of necessity. Nearly a quarter of employed Hispanic and Black or African American workers are employed in service industry jobs. Hispanics constitute 53% of agricultural workers. Black or African Americans account for 30% of licensed practical and licensed vocational nurses. Here in our own state, California Governor Gavin Newsom weighed in on these disparities.
It's the cause that unites many of the folks that work here in the state of California. They come to public service because of a deep desire to right wrongs and deal with systemic issues. Nothing more frustrating than the disparities that manifest in relationship to public health.
Well, that's all I have for you today, Wolfpack. Stay safe and keep washing your hands.